Hi, my name is Greg Law with Laws of Motion Physical Therapy. Today we're going to talk about hip flexor strengthening. So if you've ever had someone release your psoas or release your iliacus muscle, these exercises are probably going to be great for you. So a lot of the times people think, hey, my muscle's tight, I need to stretch it, I need to release it. Sometimes that's true. Many times you need to work on some of the strength of those muscles in order to help them feel comfortable elongating. So that way you can regain some of the function of those muscles. So we're going to go over some of that. The first one is the very basic exercise. So this one is just an atlas straight leg raise. So we're going to have one knee bent, the other one straight. We're just going to lift this leg up, still about equal with the opposite knee, and back down. So very basic atlas straight leg raise. If you feel comfortable and you can, it doesn't bother your back, you can let the other leg down and really trying to stabilize that pelvis as you lift up. So you don't want to see any sort of a rotation with the pelvis. You want to come straight up and down. So again, just a variation of that same active straight leg raise. I could even add a band lifting up and back down. Or I can come here and pull down with the other leg. All this is great for this left hip for active stability. Now, if I want to start progressing it to more of a foundational movement, I can come into the knees position. Hands and knees, hook the band on my foot, and I'm just going to pull through and back down. This is the resisted crawling exercise, which is fantastic to start getting some of the core muscles going and the hip flexor. So you can start off with an isometric hold, just at in range, to really start to get this muscle working, and then go through some repetition, falling up and through and back. Then we want to progress that to more of a standing or even more of a weight bearing position. I come hand against the wall. My right foot's going to stay down. I'm going to lift up onto my heels. So we're getting that extension with the right leg, working on flexion with the left. I'm going to bring this knee up to about hip height, centered with my belt or midline. Toes pulled up. Now we're just going to hold. So I can come up here, holding, but now leg shake. As you might have guessed, we can also add some resistance. So I can put a